Hello dear viewers, welcome back. I am Dr. Paul. Now if you haven't subscribed to this channel already, consider hitting that subscriber button because I bring to you health related topics that are relevant to all of us. In this video, I discuss the second hurdle that stops a person from getting timely and adequate treatment for his hypertension. The reluctance to take medicines after the diagnosis of hypertension. One of the reasons for this reluctance is related to the first hurdle we discussed in part 1 video. The sentiment that I have to accept that I am a patient or an inflicted if I were to start medicines. To know why this is not true, press on the icon appearing on your screen to the part 1 video where I explain in detail about it. Another reason is the fact that hypertension hardly ever causes any symptoms like pain or discomfort to the person unless he is very close to developing the complications of hypertension. But it's not hard to imagine the consequences of delaying treatment. Our heart, which pumps the blood, and the blood vessels which carry the blood can be compared to an electric pump and its plumbing. Now, if such a system was forced to work under elevated pressures, more than what it was rated for, what would happen? Sooner or later, the pump will fail or the plumbing will develop a leakage or a blockade. Only when it happens in the human body, it leads to the catastrophic complications of hypertension like heart failure, stroke, or cerebral hemorrhage, which are irreversible. While discussing the various treatment options with patients, one of the most frequent statements I hear is, "Doctor, can't we wait for some time? I have not been able to do my regular exercises for the past couple months. Or I have not been able to take care of my diet for the last few weeks. Or lately there has been a lot of stress at my work. So can't we wait till I figure these out and then decide on the treatment?" Here, the patient is alluding to the risk factors for developing hypertension, specifically the modifiable risk factors. These risk factors and the lifestyle modification needed to counter them has been publicized so much, and rightly so, but has been publicized so much that it had led to the belief, at least in some people, that these lifestyle modifications negate the need for pharmacological treatment. Once hypertension has developed, these lifestyle modifications like good exercise, yoga, a healthy diet, salt restriction, smoking cessation, etc. has to go hand in hand with good and timely pharmacological treatment. If you fail to lower your BP to a desirable level with good pharmacological management, the ill effect of this elevated blood pressure on your blood vessels and other organs of your body will negate any benefit that you get from this lifestyle modifications. So both has to go hand in hand. The use of one does not preclude the use of the other. Another question I sometimes encounter is, "Doctor, can I try this alternate stream of medicine first? Or can I take this drug from alternate stream of medicine together with this treatment?" Yes, you can follow whichever stream of medicine you are most comfortable with. That is the most important prerequisite for a successful treatment, for the patient to be comfortable with the medicine he is taking. But your intention to follow any stream of medicine should not be based on misguidance or myths. One of these myths is the drugs from alternate streams of medicine do not have any side effects. Now you are familiar with Newton's law, or one of the laws of nature, which states that every action has an equal and opposite reaction. Similarly, any substance intended to produce an action in the body, in this example to lower the blood pressure, will have a reaction or a side effect, irrespective of the stream of medicine that substance came from. So if somebody tells you their medicine does not have any side effect, it can possibly mean only two things. One, that substance is a complete inert substance which do not have any action, so it may not have any side effects. Or that substance was not studied well enough to understand the possible side effects that it can cause. So Whichever stream of medicine you decide to follow, take it from a qualified doctor who knows your body type, who knows the medicines he is prescribing, so he can formulate a treatment plan which will benefit you the most and prevents these side effects from causing any harm to your body. Yet another reason for this reluctance in starting treatment are the myths surrounding these treatments for hypertension. Myths like, once you start medicines for hypertension, you can never stop it, it's a lifelong process. Or that you become addicted to these medicines against hypertension. Such myths also form the final hurdle which stops a person from taking adequate treatment for his hypertension. I'll be speaking in more detail about this in the final video to this series. Now, if you like this video, be sure to hit the like button and also don't forget to press the bell icon so you don't miss the final part of this video in which I discuss the final hurdles for the successful treatment of hypertension. Thank you.